And the degree of damage is really influenced by the perspective of the individual in terms of the victim of abuse, their own internal resources, and the level of support. And one can find this in sort of adult survivors of sexual abuse, where they may have been able to respond to and process that abuse more resiliently because they perhaps were better equipped in terms of their internal psychological resources and had support that guided them and allowed them to process the abuse. But in general, in terms of what we find the psychological effects of childhood sexual abuse are higher levels of depression, guilt, shame, self-blame, eating disorders, somatic concerns, anxiety, dissociative patterns, repression, denial, and sexual and relationship problems. Now, depression in the literature in terms of the research is found to be the most common long-term symptom. And what you find is that survivors often have difficulty externalizing the abuse. So it really results in them thinking negatively about themselves. They blame themselves for the abuse taking place. And if you think of a child who, where an adult is the perpetrator and they're an authority figure or a figure of status or a loved figure, it is very hard for the child to conceptualize that kind of figure would do something bad to them. So they internalize the badness and the blame for the abuse.